I, Robert F. Kennedy Jr.,
I, Robert F. Kennedy Jr.,
do solemnly swear
do solemnly swear
that I will support and defend
that I will support and defend
the Constitution of the United States.
the Constitution of the United States.
When Robert F. Kennedy Jr. was sworn in as Health and Human Services Secretary, it made official one of President Trump's most controversial appointments. His confirmation came off the back of a fiery questioning from Democrats and Republicans alike about RFK Jr.'s record on vaccines.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines.
And under oath, RFK denied he was against them.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes
But since then, Kennedy has moved to do exactly what he promised not to. A Reuters investigation claims he considered scrapping the entire childhood vaccine schedule, discussed removing polio and MMR vaccines, and proposed spending $5 billion investigating the disproven link between vaccines and autism. I'm Daniel James, and you're listening to 7am. Today, we're bringing you an episode first published in February last year, just days after Kennedy was confirmed as Health Secretary. In it, Ruby Jones speaks to investigative journalist Brian Deer about Kennedy's 2-decade anti-vaccine campaign and why Deer thinks he's the most prominent anti-vaccine campaigner in the world. It's Sunday, July 26. This episode was originally published in February 2025.
So, Brian, for many of us, the first time that we heard of RFK was his failed presidential run. And then, of course, last year he was chosen as Trump's pick for health secretary. But you have been reporting on the anti-vaccine movement for more than 2 decades. So when did you first become aware of him?
Well, I first got wise to him 20 years ago this July coming up, when he suddenly popped up in American magazines trying to demonstrate the link between vaccines and autism. So he's been at it now for 20 years solid. He's not a particularly good campaigner, but he's got that magical name Kennedy, which plays so well in the United States.
With his help, many causes have been brought to the forefront of public awareness, and his family's connections mean he has access to the highest levels of US government.
So Mr. Kennedy, he's a product liability lawyer. What he tries to do is to get lawsuits going.
Kennedy made millions of dollars. Most of it was from his own law firm. He made about $9 million there. He also made money off book publishing.
People would be attracted by the campaigner and then moved over to the product liability lawsuits.
He gets these referral fees, sending essentially plaintiffs, people, families, to other law firms. And he refers them so that they can sue on the grounds of, say, a vaccine lawsuit. So
that's what he does. He sues people. Because one of the things about vaccine scares that people probably don't realise is that they begin as lawsuits, and they're very, very lucrative for the lawyers who drive them.
So he's experienced at campaigning against vaccines. And in 2019, that took him and you to the Pacific island of Samoa. Can you tell me what the situation was like there when you arrived?
Well, I arrived in December 2019 in the middle of an outbreak of measles, which was absolutely appalling in its extent. 83 people died, overwhelmingly children. In fact, on the day I arrived, the tally was 48 children dead. That was children aged 4 or under. And it was raging through the island, unstopped.
The streets of Samoa are eerily quiet as the country deals with the fallout of an outbreak of measles that has claimed the lives of dozens.
Arriving at the airport, there were emergency supplies being brought in, ventilators, because you need special small-size ventilators for children, were being hauled in from different parts of the world. And I set off talking to mothers who'd lost their children. And it was really quite a striking experience, I can tell you. I remember it was in the wet season and there was rain just hammering on the roof in open-fronted housing. And the mother took me through how she had been finally told that her daughter had died. She was under 2 years old. The body was presented to her in a blanket, and they took her home in the back of the car and dug a hole by the kitchen door and buried her there and put concrete over it. It was almost Christmas, and they put fairy lights up. One mother, she lost 3 children to measles, 3 children. Even now it comes back to me, like these years later. To experience that, where they were holding group funerals, they were ordering special small-sized coffins, and they were having funerals going on, big traditional funerals going on every day of the week during that period.
Okay, that must have been very confronting. Can you explain a bit about why the community there was so vulnerable to this outbreak and how RFK Jr. was connected?
What had happened was, the year before, 2 nurses on one of the islands in a remote hospital had wrongly mixed a muscle relaxant into the measles, mumps, rubella, MMR vaccine. It was a terrible mistake. And within a matter of hours, they killed 2 children by accident. As a result of the incident with the nurses, vaccination rates had fallen to a very low level. So you had a very, very vulnerable community. And so anti-vaccine campaigners kind of turned up, almost like tornado chasers. They kind of wanted to be in on the action.
The communication minister, who's also the government spokesman, Afa Masaga Riko Tupai, says that the work of anti-vaxxers is hampering their efforts to have everyone immunised.
Conspiracy theorists online were trying to suggest there was something wrong with MMR and were campaigning.
Unfortunately, these anti-vax people all live overseas, but they're using social media to influence the community and influence our population. What can government do?
Then Mr. Kennedy had turned up.
So he turned up in Samoa. He was actually there.
He actually turned up on the island, yeah, and met with anti-vaccine campaigners and was photographed with them.
One News has learned of a high-level anti-vax meeting organised in Samoa in June, just before this deadly measles outbreak. A US embassy staff member facilitated a meeting between vaccination critic Robert Kennedy Jr. and Australian anti-vax blogger Taylor Winterstein. She'd been forced to cancel.
So it's important to recognise that Samoa is a small community. There's 200,000 people. That's not a lot. So when something appears on Facebook, an awful lot of people see it. And Mr. Kennedy appears on Facebook suggesting that vaccines are an issue. And the Prime Minister, he kind of got drawn into it because he had a close family member who had some kind of developmental issue. And I think he'd been led to believe that it might have been caused by a vaccine. So he would have been very easy prey, really, for someone turning up from the United States, apparently authoritatively, telling him, oh, yes, well, that could be a vaccine side effect.
A prominent American anti-vax activist would later tell a Samoan newspaper that he had the Prime Minister's ear on the issue and that the island nation's leader had privately shared his doubts about the safety of immunizing the public. That activist, quote unquote, yes, that's Robert F. Kennedy Jr.
He was trying to muscle his way into the thing. And so Mr. Kennedy's appearance there was a news event, and so that helped fuel the problem that they already had.
After the break, what RFK Jr. says about his role in the outbreak and how he stands to profit from making America healthy again. Brian, we're talking about RFK's anti-vaccine campaigning in Samoa in 2019, which contributed to low rates of vaccination in the country, and 83 people, most of them babies, died. RFK was meeting with the Prime Minister of Samoa to tell him that vaccines had caused the outbreak. So tell me where this outbreak actually originated.
What we know is that the virus came from New Zealand. Auckland that year was going through the biggest outbreak of measles that it had in decades. And it was particularly concentrated on the south side of Auckland, which has a substantial Maori and Pacific Islander community where vaccination rates had fallen to very low levels, and goes back to the appearance in Australia and New Zealand in 2017 of anti-vaccine campaigners trying to promote a film by a disgraced British doctor named Andrew Wakefield.
The film alleges a cover-up of the claimed link between the MMR vaccine and autism. Both the link and the film have been widely discredited, of course. But the film was playing in...
They went to Australia and they went to New Zealand with this film advertising these false allegations.
Here's what those attending a screening of Vaxxed in the Northland town of Mongatoroto last night had to say to our reporter, Zach Fleming.
I've never seen any good science indicating that vaccines are actually beneficial.
So there is a connection for the virus to come through from Auckland to the islands, where it ultimately then erupted in a vulnerable community.
And so, Brian, in the lead up to being confirmed, RFK, he was actually grilled at a Senate hearing in the US, and he was asked about his role in the measles outbreak.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines.
Can you tell me about that and what he said?
So my question here is, Mr. Kennedy, is measles deadly, yes or no?
You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019.
He just shrugged it off and rejected it, saying that nobody knew what was killing the children.
There are 83 people died when the tissue samples were sent to New Zealand. Most of those people did not have measles. We don't know what was killing them.
And I thought, well, that was a very strange thing to say, because not only had there been samples taken and tested, so they had that information, but when the government had a 2-day lockdown where everybody was told to stay home and vaccination teams cruised around the islands offering shots to people, when that had all happened, the outbreak went away and the children stopped dying. So how Mr. Kennedy came to the conclusion that nobody knew what the cause was, I think was a bit extraordinary. But then he is a great one for saying things that don't check out.
And so, vaccines aside, what do we know about RFK's agenda to make America healthy again? What can we expect?
Well, Mr. Kennedy is talking now about making America healthy again, without often revealing that he's actually taken out a registration on that expression. And I think he made an enormous sum of money selling it to the anti-vaccine campaigners.
President Trump is committed to restoring the American dream, and 77 million Americans delivered a mandate to him to do just that, due in part to the embrace and elevation of the Make America Healthy Again movement.
And he's talking about diabetes, starting wellness farms, getting everybody to lose weight. But behind that is this anti-vaccine agenda, which he is not going to give up on. And he will have a very great deal of power to intervene in that area, deciding which vaccines should move from the recommended list to the essential list, if you like. That he can intervene in court cases, he can intervene in the advisory committees that make vaccine policy, because he actually appoints most of the members of them. And he's already had his recommendations taken up in some of the appointments that have been made to head the federal agencies, such as the National Institutes of Health and the Centers for Disease Control and Prevention and such like. So he's going to have a great deal of power, and the credibility that he will give to avoiding vaccination for reasons that have not been established as valid will lead to a rise in susceptibility to vaccine-preventable illnesses, outbreaks of disease. And it's very difficult to row these things back.
Brian, thank you so much for talking to me.
Pleasure.
I'm Daniel James. 7am we'll be back tomorrow with an interview with former Qantas CEO Alan Joyce. After almost 15 years running the airline, he left at the height of an extraordinary public backlash, dubbed Australia's most hated man. Now, after years of silence, he's defending the controversial decisions that defined his final years at Qantas as tough but necessary. We put those decisions and those choices to him.
You know, when you look back to the period when the decision was made in 2020, we were staring at potentially the company going bankrupt. We had to make a whole series of decisions to make actually up to 10,000 people redundant. I think around the world in aviation or aviation-related jobs, over 2 million people were made redundant. It was the worst period in our history, and we were fighting for survival.
You believe it was the right call, but you also write that had Qantas known how quickly travel would return, it might not have done it. Doesn't that suggest that it was based on an assumption that turned out to be wrong? So doesn't that mean it was the wrong call?
Well, I think, hindsight's great, Daniel. I say in the book, you make decisions in real time and they're evaluated in hindsight. And I think that's the reality of a lot of things we do in life. But I'd ask you to put yourself in our position in the middle of 2020 when we made these calls. And at the time, nobody knew there was going to be a vaccine. Nobody knew that there was going to be a rapid rebound.
That'll be in your feed tomorrow. Thanks for listening.